Hi, I'm Anya Suico, and with me is Dr. Gia Pastorfide. Dr. Gia is an active consultant at the Makati Medical Center and Cardinal Santos Medical Center. She's also the clinical associate professor at the UP College of Medicine Department of Obstetrics and Gynecology. Adding to that, she's the assistant director of the Victory Art Laboratory of the Philippines. Dr. Gia, thank you also for joining us.
Thank you for inviting me here.
Yes. So our first question actually is, what kind of nutrition or anong pagkain or supplements ang makakatulong sa pagbubuntis?
Well, yung importante dyan naman is healthy yung diet. So what we advocate is a healthy lifestyle and healthy eating. Actually, a healthy diet will cover already all the vitamins and minerals that will make a pregnancy healthy for the mother. So we also advise the usual vices that you shouldn't do. So we tell them to refrain from smoking, to refrain from drinking, because those vices they give free radicals which are toxic, also provide a toxic environment. And also we tell them to limit their caffeine intake. You know, a lot of people they like
Yes.
drinking coffee early in the morning. No, it gives them the boost in it. But then the caffeine, it's not very good in a lot yung kung marami yung iniinom, no.
Soft drinks even.
Well, the sugar content is the one that's bad with soft drinks.
Okay. So there's also been a lot of talk and discussion about generic fertility drugs that are flooding the market. What are your thoughts on that?
I think generic drugs is very good in that it creates a healthy competition between all the pharmaceutical agents, no? And it gives patients a cheaper alternative. What is important actually is the active ingredient in the drug. So I think if it's the patient's preference actually. So a generic drug should be as good as the branded drug.
I see. Okay. Thank you. Now we're going to a question that actually came from our audience. Maaari po bang mabuntis kahit mababa ang matres?
Of course. I think that's one of the common misconceptions that we have to correct, no? Because yung mababang matres, they're probably referring to the positioning of the uterus in more scientific terms, if it's antiflex or retroverted. So, kadalasan narinig mo yan sa mga manghihilot or na mababa daw yung matres. That's a normal variant lang. It's like being left or right-handed. We can't say being right or left-handed which one is abnormal or not. They're just normal variants. And both conditions, whether it's antiverted or antiflex, pwede naman mabuntis.
Oh, okay. Thanks so much for correcting that misconception, Doc. And thank you for joining us. We hope this
Thank
is
you.
helpful for the couples who have these kinds of questions to inform them about the things that they can do. And we're going to be here all day to answer your questions about your baby goals. Thank you.